I was having epilepsy during the 60s, and I guess society was less aware of the realities of epilepsy, and probably, if I'm correct in using the word, more fearful when they would see somebody with it. So as a result, I did not tell many people that I had seizures. My very close friends knew I had it. But that was about it, because one just didn't talk about it then. My seizures commenced probably when I was around 7 years old from an accident I had on the street. My first seizure occurred, the symptoms started then, but the seizure was actually when I was 10 years old. And a few years later, my parents took me to the doctor to find out more what it was. And when I was 15, I was referred to the Neuro, and they found out fairly quickly what it was. It was scar tissue on the part of the brain that was a result of the accident I had. The surgery was, from my perspective, 100% successful. There were a few very minor results from it, but I don't see them in a negative way. Now, being in a hospital is being in a hospital, but the comfort, the human comfort, the physical and the mental and the emotional comfort one had, or I had at the Neuro, made it so much easier. That's one aspect of the Neuro where there's a very human relationship between the clients, the patients, and the professionals and the staff there. They welcome me, and I'm sort of part of their team in some small way as well, and that I appreciate, because I've learned a lot.